Hi everyone. On today's Face Facts by Dr Yusra, we are talking all things lip fillers, what you need to know before having lip filler, understanding the wild west of aesthetics, knowing that there are all kinds of different fillers out there, and how to choose the right practitioner for you, the right filler for you, and how to have beautifully augmented lips without looking fake. Hope you enjoy. Hi everyone. Hi Sophie, how
Hello.
are you?
I'm fine, thank you. How are you?
Freezing.
I know,
I'm like hugging onto this warm cup of tea on this freezing icy day outside. So we're in the middle of winter, and today we are talking about lip augmentation, lip filler.
Yeah.
We're going to share with everyone everything that they need to know before having lip filler, talk through all the frequently asked questions, discuss complications, risks of lip filler, frequently seen side effects, and yeah, everything in between. So I know you have some questions. Let's get to it.
My first question, what are lip fillers?
Great. So lip fillers are essentially usually hyaluronic acid gels that are injected into the lips to improve the shape or change the shape, and improve the volume or change the volume.
Okay.
I'm mindful about using the word improve, but generally to change the shape and make the lips a little bit bigger. Sometimes they can also be used to hide scars in lips, like for example, scars after trauma, if someone cut their lip, or scars after a cleft lip, which comes with more significant risk because that is a congenital deformity and is usually related to a deviation of the norm of the underlying anatomical and vascular structures as well, as well as fibrosis, which means hardened scar tissue.
Yeah.
But lip fillers are commonly used to hide scars and deformities as well.
Okay.
In the past, people used to have collagen lip fillers. Bovine collagen lip fillers, yes, like Leslie Ash. Remember Leslie Ash? So one of the first things that she had back in the day when hyaluronic acid wasn't used, they would use collagen. And that would, unfortunately, people would respond to collagen, particularly bovine collagen, and end up with lumps, bumps, scarring, contraction. And let's say they had enlargement that they didn't like, you couldn't reverse it.
Yeah.
Hyaluronic acid, which is a polysaccharide, a sugar molecule, is hydrating by nature. It holds 1,000 times its weight in water, and it can be reversed by using an enzyme that can be injected into the area that has been filled to break down the hyaluronic acid. And not all hyaluronic acid fillers are the same.
Yeah.
Some lip fillers last longer than others. Some lip fillers are thicker than others. Some lip fillers are easier to dissolve than others. And some lip fillers get puffy and migrate and don't look so nice as others. So they're all different.
All different. Leading on from that, how long on average do lip fillers last?
Okay, so this really varies person to person. Some people will find, yesterday I had a patient who came in who said, I'm having lip filler every 3 months and this particular brand of lip fillers isn't, lasting long on me. And when I looked at her, she had migration all above her lip line. And so I wonder, is the lip filler going away or is the perception of the lip filler going away? Because when you augment the lips, what will immediately happen is an enlargement of the tissues, which is not just the filler, but it is swelling secondary to trauma.
Yeah.
Because the lips are vascular, they're red at rest, right? They're pink at rest. The rest of your face is, your face is white, mine is brown, but you know what I mean. Okay, it's the area that's pink. And that's because it's full of blood vessels and you've got this really thin mucosal tissue and thin skin over it. So you prick it, it bleeds. You prick it, it swells. It responds immediately to trauma, but it heals exceptionally quickly because of those blood vessels. So immediately on the day of filler, often lip filler in particular, you look in the mirror and you go, oh my goodness, it might look bigger. And I say to my patients, I often do it in stages, and I'll say to my patients, look, let's do half, show you in the mirror and see how you feel. Because, and we can talk about volumes, but what happens is after the lip filler settles, which takes usually 4 weeks, they lose half of the volume that they saw on the day.
Yeah.
Okay. Now, how long lip filler lasts, again, depends on the patient, depends on the lip filler used. I'd say for the lip fillers that I use, I find on average it lasts 12 to 18 months. And when I say it lasts, I mean the impact.
Yeah.
Because what happens over time is filler, hyaluronic acid gels disintegrate and they lose their ability to hydrate and hold water. They don't actually just disappear. Okay, that's what we thought once upon a time. We thought, because manufacturers told us fillers last 12 months, fillers last 18 months, however long they were tested on the box of manufacturers, we would say to patients, this is how long it lasts according to the manufacturer's guidelines. Now, through MRI studies and other such ultrasound assessments, we know that filler lasts a lot longer than we once thought, which is not necessarily a bad thing. And I think we really need to talk about that, because in the wild, wild west of social media, the double-edged sword is that a lot of people are seeing misinformation and taking that to be gospel. And they're seeing MRIs of patients with filler that has been there for a long time and going, oh my God, filler is the devil. No, actually, if the filler is sitting there without causing problems, without causing adverse reactions, is maintaining and continuing to provide volumization in a patient who might have a volume deficiency or want to treat a volume deficiency, then the filler lasting a long time actually may be a positive thing, because they don't have to keep repeating the treatment. And here's the crux. You don't need to have top-ups every so often.
No.
It has to be evaluated on a case-by-case basis.
Yeah.
Like, so if you're quite open, you've had your lips done. How long ago is that?
4 years ago.
You still have the results.
Yeah, still have them.
It's still there, still looks fab. I wouldn't touch you again with lip filler because you don't need it. So some people hold on to filler and it sits there and it does a brilliant job. It integrates beautifully, it looks natural, feels kissable, no issues. No need to panic.
Yeah.
It's not migrated. Fine. Fabulous. Great. Would you rather that, or would you rather keep having to go in every year to have your lips done?
Oh no.
You're glad it's once.
I am so glad.
Once and done, or once every so often, right? Yeah. So it's not so frequent. So yeah, it does depend on the filler.
Yeah, and the patient.
And the patient.
Yeah.
Yeah.
Are they safe?
Yes. Hyaluronic acid gels generally are safe. That is not to say that they are risk-free. There are risks associated with dermal filler. Sorry to interrupt the podcast. I am coming to you to say, if you're enjoying this, then I would really love for you to like, subscribe, follow along, and share this with anyone who might find this useful. We are investing a lot of time, energy, and resources into bringing you the best of the best in education, all about faces, bodies, aesthetics, and wellness. And I want to continue to do that, but I need you to subscribe. And if you can, if you have any questions, if you want us to address any particular topics, then please leave a comment and we will certainly create videos for you to address those. Thank you, and I hope you enjoy. Lip filler is not free of risks, but generally speaking, augmentation with hyaluronic acid to volumize the lips and change the shape is a safe procedure. As compared to silicone implants or collagen injections, and is a relatively low risk procedure when done in safe hands. I would say when done by a clinician who understands and has been trained medically, and can manage complications should they occur.
Yeah.
Risks. There are risks with dermal filler. There are risks with lip filler. There are big major vessels that supply the nutrition and the blood to the lips. There are little capillaries and arterioles, but the main vessels are the superior and inferior labial arteries, which are a branch of the facial artery, which is a branch of the external carotid artery. These are big vessels. They sit within the lip, usually within millimeters of the lip line. So there are areas in the lip that are higher risk to treat, which is why it's vital that your clinician is a medically trained clinician that can understand the risks associated with dermal filler and avoids areas of high risk. Having said that, your blood vessel is different to where my blood vessel is. So there's something called vascular variability. No two people are the same. No. So now we often employ the use of newer technologies that enable us to see beneath the surface, because no matter how good you are, no matter how many lips you've augmented, no matter how many years you've been doing it, you may be a wonderful artist, but God didn't give you x-ray vision. I don't have x-ray vision. So ultrasound enables me to see where the blood vessel is underneath the skin, and therefore I can do what we call vascular mapping. I can map the position and location of that blood vessel and avoid it when I am injecting with dermal filler. So that reduces the risk of vascular incidents, i.e. filler going into a blood vessel and causing a vascular occlusion, which can cause necrosis, which basically means loss of oxygen and blood supply to the tissues, which can result in the skin breaking down, cell death, even scarring. And we've all seen bad news make news, right? So as long as your clinician diagnoses promptly, then these can be reversed and you can stop the progression into necrosis. That's why it's really important to see someone who can diagnose and treat. The other thing that is associated with lip filler is swelling, bruising, bleeding. That's transient. It goes away. We don't stress about that.
Yeah.
Lumps, bumps, asymmetries, you can correct them, tweak them, dissolve them. There is another risk associated with dermal filler anywhere in the face, but also in the lips. The lips are dynamic. They're constantly moving when we're speaking, smiling, eating, kissing. They're muscle. They're a part of our body that is constantly under movement, animation. And the muscles surrounding the lips are constantly moving. So that's one reason why this is a higher risk area of having what we call filler migration, where the filler can leave the tissues or migrate and end up in the surrounding tissues. This is more commonly associated with technique rather than filler. So it's how the injector is placing the filler and what level they are injecting the filler. It may be also exacerbated by certain patient's type of anatomy, those with hyperactivity of the orbicularis oris muscle, and also the type of lip filler that's used. And then another thing is something called granulomatous reactions or delayed onset nodules. So delayed onset nodules are when the body recognizes that there's a foreign body, it doesn't like it, and it creates a little nodule of granulomatous tissue. That can happen anywhere in the face with any dermal filler. Some fillers have a higher risk of causing it because of their higher inflammatory profiles. Other fillers less so. Okay. And this is also why we talk about sterile fillers, sterile technique, using fillers that have been around for a long time, that have been tried and tested and regulated. That gives me a lot of comfort. I don't use products in my clinic that don't have quality assurance like FDA approval or CE mark. It's a non-negotiable, you know this. It's just a non-negotiable. I wouldn't have it injected in me, therefore I wouldn't have it injected in someone else. So I want a product that has a high safety profile and a low risk profile. Now, when do delayed onset nodules happen? Usually they're seen on average 24 months post-treatment. And they can be resolved sometimes with non-surgical interventions. Very rarely they need surgical excision.
What are the alternatives to lip filler? Are there alternatives?
You can have a off-label treatment called a lip flip, where we use botulinum toxin into the lip line to reduce the contractility of the muscle surrounding the lip, which flips the lip upwards. That's called the lip flip. It can create the illusion of a fuller lip. Usually lasts approximately 3 months because botulinum toxin doesn't last that long. Downside of that is no longevity. We'll need repeated treatments. Harder to kiss because if you can't contract, you can't purse your lips. Harder to drink through a straw. Sometimes may also impact pronunciation because the lip seal and the way our lips come together impact the sounds that we make when we speak. So if you're having a lip flip, know that may impact the quality of your speech or the clarity of your speech.
Perfect. And sort of leading on from that, the lip flip was a bit of a trend that sort of came around quite recently. What are other trends that you're seeing at the moment?
Oh God, there's so many trends. There are we call them fast aesthetics, trends that come and go. Sometimes when they go, you're like, phew. Often, actually. One of the trends that I think were really not helpful was the Russian lips, where patients were having excessive amount of filler injected into the lips and tenting it from the wet-dry border of the lip to outside of the lip, which increased the risk of migration. Then on social media, you saw people putting tape down as if that would stop the spread. It's just a complete, utter nonsense. It isn't going to stop the spread because the filler is a hyaluronic acid liquid gel and it will travel no matter how much tape you want to put in your mouth. And guess what? That person's not going to starve. They're still going to eat and sip water and contract their muscle. So that was a nonsense and I'm glad it's gone. But I think what we really need to be cognizant of as aesthetic practitioners is trends will come and go. And we have to be aware of those trends because the world that we live in, the majority of us are communicating online. We're on social media. We are exposed to various different images, ultra filtered images of men and women where they are a huge deviation from the norm in terms of it's just not real, right? Nobody is perfect. I have seen queens, kings, princesses, celebrities. Everyone's got pores. Everyone. People have discolorations, skin tone irregularities, skin texture irregularities, asymmetries. That's called being human. And then online they look like picture perfect because of the wonderful use of technology and filters. I mean, I've asked them to put a filter on this, but they won't. So filters are a problem. though, right? They're a problem because people come in thinking that they can look like that.
Yeah.
And you can't.
No.
And that creates an unrealistic expectation.
Okay.
And also it impacts you. Because if you're exposed to women looking a certain way and you don't look that certain way and you perceive them to be successful and beautiful and liked and whatever else, then what happens is particularly young, vulnerable adults think, I need to look like that in order to succeed in life or to be deemed attractive or to find a partner. And so they're influenced by it. And that drives their behaviors, their self-esteem, their self-perception. That drives them into clinic. And that may be a motivation for treatment. So the ethical practitioner will discuss that with the patient and see, are you having the treatment for the right reasons? Or are you succumbing to a trend and getting lip filler because Kylie Jenner had lip filler? And actually you might change your mind later, which is okay. But we really need to have that conversation so that we safeguard our patients. And they don't succumb to the newest form of peer pressure, which is social media.
What is the one thing you would say to patients who are wanting lip filler?
I would say don't go too big, too quick. Take it nice and slow. Find a medical practitioner who is medically licensed, who is regulated, who cares, who is ethical, and who will safeguard you, and who is not going to put filler in or fill you up like an eclair because they see you as a quick buck. Find somebody who will assess your face holistically, because one of the worst things is when the lips walk in before the rest of the face because they have been made disproportionate. Beauty is in proportion and balance. And so it's so, so, so important that your practitioner, your aesthetic doctor, your clinician, your nurse prescriber, whoever, is assessing the face holistically and making sure the lips that you want are going to suit you. Because if I took Angelina Jolie lips and I put them on my face, I'd look ridiculous. So we got to make sure that the patients understand that the lip augmentation is the icing on the cake and that everything else needs to follow. And ultimately, that they look good, not look done. That they look fresh, not look fake. And that's my ethos.
Okay, perfect. Well, thank you for sharing.
My pleasure.